Hi, I'm Ken Cutbush. I'd like to talk to you about the risks associated with getting a rotator cuff repair surgery with me. It's very important always when you have an operation or booking in for surgery that you consider what are the pros and cons of that surgery. You want to know what you're getting yourself into in terms of the rehab process, and you also want to know what the risks of the surgery are. All surgeries have a risk associated with them. Now, the rotator cuff repair surgery that I do is always arthroscopic. I don't do open rotator cuff repairs, and that's significant. Arthroscopic rotator cuff repair surgery is not particularly risky surgery. Nevertheless, there are some risks that you need to consider. All surgeries have a risk of infection. With my rotator cuff repair surgery, the risk of infection is 1 in several hundred. It's quite unusual to see an infection, quite rare, but they do occasionally occur. The other thing you do need to definitely be aware of is that any rotator cuff surgery has a risk of frozen shoulder. Frozen shoulder is a condition that will always get better, and it actually helps the rotator cuff repair heal up. It does help the healing process because it's really an over repair reaction, the frozen shoulder syndrome. So it certainly helps the rotator cuff repairs heal. The other thing too is like having an internal splint in your shoulder. It stops you moving, so it's like having a sling inside your shoulder. So it definitely does decrease the risk of the rotator cuff repair re-tearing. Nevertheless, it can often be uncomfortable. The shoulder's stiff and painful while you've got the frozen shoulder, and that takes some time to get better. It can take months to get better. Very, very rarely the frozen shoulder is quite severe and quite uncomfortable and quite distressing, but that's fairly rare. Often it's quite mild. Often it's just a generalized tightness with a little bit more of an ache in the shoulder, and that's the more usual thing we see. There's nothing we can do to stop frozen shoulder from occurring, and there's really nothing to do to hasten it to get better. We just have to wait it out and wait for it to get better by itself. It's your shoulder and the way it heals up. Nerve injury is exceedingly rare with rotator cuff surgery. That's something else to think of. It's 1 in several thousand risk that we're talking about. The other thing you need to think of is the anesthetic risks. There's always a risk with any anesthetic, and you do have quite a significant anesthetic. It's a general anesthetic, and it's not a light anesthetic. We tend to want to drop your blood pressure a little bit, and so that requires quite a deep anesthetic sometimes. So there is a risk from the anesthetic, and I think everyone knows that. Risk of dying from an anesthetic in Australia is 1 in 100,000, and my anesthetic colleagues tell me that Australia is one of the safest places in the world to have an anesthetic with that rate. To put that in context, your risk of dying on Queensland roads this year is 1 in 10,000. Other things can happen is you can get DVTs, you can get chest infections and so on. All those sort of little things can happen. You'll have little wound issues related to the port sites. Sometimes a little stitch might pop out. We close the port sites either with a steri-strip or a stitch that's buried under the skin and the steri-strip. And sometimes those little stitches that are buried under the skin that are dissolvable can pop up like little bristles, and it will take a while for them to fall off and go away, which they will. And it may just be easier often to get your GP or physiotherapist or come in and see me, and we can pull that stitch up and cut it off and let it drop back down. If you do have problems with your wounds, send a picture into the office. We'll have a look and let you know if there's a problem. You'll have a sling. You can get swelling above the sling. Often you get a bit of a lump here just in the upper arm, and it's because the sling is coming in here, the swelling is coming from the shoulder and running down, and so you can get some swelling just above the sling inside the arm. Bruising is very common. The bruising tracks from the shoulder underneath the skin down. It's blood that runs underneath in the subcutaneous tissues down the skin. It's not that you've got bruising here, it's coming from the shoulder itself and running in the tissues. The sling, you can get some ulnar nerve symptoms. The ulnar nerve can get stretched around behind the elbow related to being at 90 degrees of flexion in the sling, and you'll get some numbness in your little and ring finger. You may even get some weakness in your hand. If you get that, take your arm out of the sling and stretch your arm out. And if you are tending to get it, what we'll do is instead of being bent up at 90 degrees, we'll get your arm to straighten out a bit. It only needs to be slightly bent in the sling to control the rotation and get the sling to work. We just don't want it out straight. Your wrist, the sling should come up to your metacarpals. so that the wrist isn't hanging out over the end of the sling, because you can get some wrist pain from that. You can even get de Quervain's tenosynovitis related to the sling. So you want your arm tucked back in the sling, with the sling coming up to the knuckles there. So I think that's a good idea of the risk that you can have and you need to consider when planning to have rotator cuff repair surgery. I hope that helps you and makes sense to you. Anyway, take care.